Good morning, everybody. It is 7:12 right now, and time for the Orthopedic Minute. And we talk Orthopedic Minute, we talk about these guys, our friends over at DMOS. And we have Dr. Jeffrey Rogers joining us in studio right now. He's been over at DMOS for quite some time, haven't you?
Yes, I have.
Okay, since when?
Oh, 1997.
He's doing one of those.
It's been a while.
But you have a specialty, and right before we went on camera, we were talking about you are really specific when it comes to what your specialty is. And I said, well, you deal with this part of the body. He said, no, I deal with which part of the body?
From the elbow down.
Elbow down.
That is very specific.
Zeroes in. And what drew you to that portion of the body?
The fun of it was the variety of things you get to do from the elbow down. So it's unlike a person who does hip or knee replacements. That's kind of the same thing over and over. But from the elbow down, there's a huge variety of things that we take care of, from bones, tendons, nerves, tumors, arthritis, even plastics kind of surgery kind of things, skin grafts, tendon grafts, all kinds of things.
So that just intrigued you, and still to this day. But when you're talking about things from the elbow down, obviously you use your hands and your fingers and wrists a lot, and people have a tendency of injuring those areas. And then they need some things to help relieve some of the pain, and that's where we're going today. We're talking about some of these drugs that relieve the pain and how dangerous some of them could be.
Yes.
Okay, what are we talking about?
Well, the opioids. I've had an interest in the opioid crisis for probably since 2012. We did a study at DMOS, and we recruited a couple of DMU students, and we were interested in learning how needed as needed pain medicines are. Because no one had ever before that really studied how many pills do you need after a procedure? And we've discovered that a huge number of pills were being left over, and those are then at risk for being diverted or creating dependency.
How did this even begin is basically what I want to ask.
I was listening to my patients, and they said, hey doc, I didn't take all those pills you gave me. So that happened a few times, and I started wondering, well, gee, how many times does that really happen? And it happened a lot. When we looked at 250 patients, we had 4,600 pills left over.
So was that a matter of over-medication? Like too many were being prescribed for the situation, or
Correct.
They just weren't taking them, or it's not necessarily even needed?
Yeah, no one had ever really looked at, after you do a carpal tunnel release, how many pills do people actually take? We just gave them 30 when we were in training, because that's what fit in the bottle, or that's what your mentors did, and no one really studied it. And now we discovered that we were dispensing a huge number,
because some of the information, some of the directions were take as needed.
Correct, and no one looked at how needed as needed. If you look at the graph there, you look at opioid consumption worldwide. In the U.S., far and above exceeds the rest of the world in how much opioids, and those are the medicines like hydrocodone, oxycodone, Tylenol with codeine, a huge number, and so we were looking at the amount that people were consuming, and it's staggering, it's mind-boggling.
Okay, so let's talk about some people that might be like, well, I need something to relieve the pain, especially post-surgery. How do we manage that, but in a wiser way going forward?
Well, I think it really starts with having the conversation before the procedure. What we do is we create injuries. Operations are injuries.
Right.
And we expect it to be uncomfortable, and just preparing the patient that they will expect discomfort. It's going to be short-lived. They will get through it okay. We're going to give you some medicine to help you get through it okay. But it's going to be a very short duration of treatment with pain medicine.
What makes opioids so powerful?
They're tremendously addictive. When I was in training, we were taught if you had pain and you took an opioid, you couldn't get addicted or hooked on the medication.
Really?
But it turns out that that's absolutely false. And that's really the basis of the lawsuits that you're seeing in the newspapers against Purdue Pharmacy and even the distributors of the medications, that no, they really are addictive, and they're very dangerous.
Was that a lack of research, or just they wanted to push something out that would help relieve pain, basically? Hard to say.
The argument is that it was fraudulent marketing by the big companies.
Okay, and you said you've been standing behind what's happening with these lawsuits so far.
Yes.
So trying to make a difference there. So let's go back to the point that you said many of us might be looking at our medicine cabinet, and I know there's an event coming up this weekend where you can safely get rid of medication that you're no longer using. But let's say we see an opioid in our medicine cabinet. What should we be doing at this point?
You can use the Take Back Days. They're a great event. It's a kind of reminder once a year, just like putting the battery in your fire alarm.
Right.
To go through your cabinet and see what's in there and see what you can dispose of. Whether it's an opioid or any other medication, they still all can be very dangerous if you're not using them anymore.
Right.
Some pharmacies are giving out disposing systems, and these are little charcoal disposal
That's
packs.
what these are. So what you tear it
Little,
open.
like disposable bags?
Yeah, there's activated charcoal in them. You just tear it open, and
Okay, he's gonna open one up here, so we'll see what's inside.
maybe
here.
I can open it up.
It's like those bags at the grocery
I
store.
know.
It's doctor proof.
It is doctor proof. So it does open.
There it is.
And then you just dump it in, put some water in.
Okay,
close
let me
it.
take a look at inside
So
here.
you said there's like charcoal in there.
Activated charcoal
I'm gonna pull it out so you can see it here.
that dissolves the.
There it is.
There you go. It dissolves the pill
is right there.
so that it can't be diverted or used by anyone else.
Anyone
And then
else.
it's safely disposed. Then it's not going into the sewer system and
Right.
flushing it down the toilet.
Because that's one, we just want to make that very clear. That's not something you want to do. You don't want to take your pills and dump them down
So
the toilet
this-
or the sink or anything like
This
that.
here, the pills in there, then and some warm water, and then you seal it.
Yeah.
Okay.
And Walgreens
simple.
is giving those out, as far as I'm aware. You can also now return medications to pharmacies, which wasn't the case 5 years ago.
I just saw one of those 2 days ago at my pharmacy.
Or your local police department, most of them have a little drop box, just like a mailbox. You can just drop it in any day.
Wow. They're great things to keep in mind.
So what's the biggest thing we need, our biggest takeaway when it comes to opioid? Because they're in the headlines everywhere. There's a great attention to it right now. But as a doctor, what is the biggest takeaway to this point?
I think the takeaway is that they are dangerous. They are a controlled substance, so once they're given to you, you still need to be mindful that you need to control them.
Okay.
And they're very helpful. They're very effective, but very short term.
Okay.
Very short term. Okay.
Yeah, and don't just dispose. Don't put them in the toilet. Take care of them the proper way.
70,000 people in the U.S. die each year of opioid overdose. That's more than in the entire Vietnam War.
Wow.
Every year.
Hard
That
to
number
believe.
is staggering every time I hear it. Okay, Doctor, we appreciate you joining us this morning. Great education coming from DMOS this morning as we give it to you all the time here on Iowa Live. Doctor, if people want more details on what's happening with DMOS, where should they go, especially when they're talking about an important subject matter like this?
DMOS.com.
All right. So all the information that you need, you see a couple of locations there to take care of you. One right down the street from where we are. And is that where you're located?
Yeah, that is where I work.
All right. So you go see
So-
Dr. Jeffrey. He'll take
If you have
care of
something from the elbow down,
Elbow down.
he's
the
your
guy.
man. I love it. I love it.
Thank you very much, sir. Appreciate you being here.